Welcome to the IDD Get to Know Me Special Olympics edition. I'm your co-host Victor.
And I'm your co host, Melanie.
In this edition of the podcast, we will be diving into some of the topics important to the Special Olympics community.
Before we start, let's explain what IDD means.
Great idea! IDD stands for intellectual and or developmental disabilities. You will hear from us, people with IDD, and experts on specific health topics.
Today's topic is all about health check ins and the importance of regularly seeing your doctor or healthcare professional as a Special Olympic athlete. We will be hearing from five different guests. First off, Dr. Yona Lunsky, a researcher and clinical psychologist, followed by Dr. Ullanda Niel, a family doctor, then by Heidi, Mallett, and Monique Shah, who are both fellow Special Olympics athletes, and June Shah, a coach and family caregiver. We hope you enjoy. Today, I am thrilled to have Dr. Yona Lunsky with us today to share some of her experiences and thoughts. Welcome.
Thanks, Melanie. Glad to be here.
Before we get started, maybe we can get going with a little bit of a quick introduction and a bit of an icebreaker. So please introduce yourself and tell us what your favorite hobby is, maybe for beginning.
All right. So my name's Yona, and I'm a psychologist and I'm a scientist. I do research on health, including the health of Special Olympics athletes. And I'm really interested in ways to improve healthcare for people who have disabilities. And my favorite hobby, I did learn how to ice skate in my 40s, and it is winter, so I'm excited that the outdoor rinks are going to be freezing again, and I hope to bravely get back out on the ice to do some very simple circles around the ice, enjoying the outdoors. I also like walking with my dog.
I applaud you very much for being able to skate. The conditions I'm born with prevent me from skating. I have the worst balance of all. I'm not gonna lie.
Yeah.
But at least I can go tubing or sliding, which are some stuff I enjoy doing. But I have to give you massive kudos and props on the skating. Massive kudos and props.
I do fall, but I pad myself really well, and I wear my helmet, and I just kind of go really slow, and just still not an Olympic skater yet, but I do enjoy being outdoors.
That's wonderful. That's wonderful. So since we are here to also talk about the health check-in study, can you maybe tell us about the study and what you've actually found?
Yeah. So we did a project sort of in the later part of the pandemic where we realized that a lot of people, weren't going back to healthcare. I think when the pandemic started, everyone kind of stayed away from their doctors as much as possible. Everyone stayed home. But, over time, people were maybe missing out on getting some of the healthcare they needed. So we thought it'd be really important. We had a course that we had for people who had disabilities and also for families, kind of saying, well, let's kind of think about how to get back into taking care of our health, right? And so we encouraged people to have what we call the health check-in, which was really not going to the doctor because there was really something awful that was wrong, but making an appointment to just check in and say, this is how things are going head to toe, right? Here are the questions I have. Here's what I want to talk about. And so we wanted to study, if we taught people about this in a course and we taught them about why it was important to go back to see your doctor and talk about these things. And we also had a little tool, it was like a visual tool that had different things you could check that you wanted to talk about, and you would bring that into your appointment. We wanted to see, would people use that tool? Would they go to see their doctors? And then what would happen when they did those visits?
I definitely hear you about the challenges about going to visit the doctors during the pandemic, and I can see and certainly understand how people might feel scared for a health check-in with a doctor. I can tell you that as somebody who relies heavily on public transit and paratransport, now that we're in the cooler and winter months, people with IDDs often rely on public transit getting around, and that requires a lot of logistics. I really wish in this day and age that doctors' offices would be better equipped or better informed on accessibility when it comes to people with IDDs who heavily rely on transportation.
I hear you, Melanie. So I think on the one hand, we want to encourage people to go to the doctors, but there's all kinds of barriers that can get in the way from just making an easy doctor's appointment, right? And so some people might not, know how they're going to get somewhere, or like you, they might rely on transportation that can get them there way early or way late, and that's quite stressful. And it's almost like there's a disconnect sometimes between what your experience is or what you want and then what they're able to do at the doctor's office. So I think these kinds of appointments have a lot of planning that go into them, and I can understand why people maybe sometimes want to avoid them. But it is really important to see your doctor regularly to let them know how things are doing, because, when we treat a small problem, it's not a big deal, but if it goes for a long time untreated, then it can get much more complicated. And that's the kind of thing we really want to avoid, that we don't want to happen, right?
Well, for sure, for sure. And just to maybe wrap up this point before I go on to the next one, I'm always shocked, if not surprised, to find out that it's my role or my duty as a patient to ensure proper communication between departments.
Yeah. So that's another really important part about the health check-in and about healthcare, is so much of it is about the communication. And there's the communication that you have with the person you're seeing, the doctor or the nurse practitioner, whoever. And then there's the communication with different people who are involved in your healthcare, because you might be seeing more than one doctor, not just one, right? And we need to make sure everybody's on the same page about what's going on, which is another good reason, I would say, because some people, and maybe like with you, some people see different kinds of specialists. So I might see a psychiatrist, or I might see a neurologist, or I might see, a gastroenterologist, someone who looks at things around my stomach. They're all doing different stuff, and somebody's got to know what everybody's doing. So I think you as a patient need to know that. But also sometimes there's someone like a family doctor or nurse practitioner who kind of is the medical home and knows the different things that are going on with different people. And we want to keep that information updated as often as possible, especially if there's some kind of emergency or something. We want to know everything that's going on, so we have a good, complete picture.
Yeah. And I think we're already starting to answer the next couple of questions, because we just started to talk about challenges and some of the challenges that Special Olympics athletes like myself face.
Yeah.
Can you please share or explain what some of the biggest challenges that Special Olympics athletes with intellectual disabilities face when it comes to getting good health care? What are some solutions you have?
Right. So we've already talked about the challenge of transportation that you raised, and also challenges around communicating with your doctor and also keeping everybody who's involved in your healthcare. It's almost like if we imagine, you might be in a team sport and there's all these people on your team, and someone is, I don't know, outfield if it's baseball, and someone is the catcher, and someone, like, we all have different positions, right? So with healthcare, there's all these different people giving bits of healthcare. They all have different positions, but we need to work as a team. So I think that's a big challenge, and that's part of what you were talking about. So the solution for that, I think, comes back to how we communicate about our health and having really simple information about ourselves that we keep updated, that everybody can look at or know. So we're all on the same page, or again, we're all on the same team, right? Transportation is a challenge that doesn't have to do with the doctor themselves, but it's good for them to understand those transportation challenges, right? So maybe a little more flexibility around appointments, or you figuring out, if you have to rely on that kind of transportation, what can you do for that extra time while you're waiting at the doctor's office? And how can the office staff understand and help you out with that piece? Because It's not the doctor who's bringing you into the waiting area, right? It's people who are working in the office booking appointments. So there might be better times to book appointments and letting them know that you're going to be coming by, accessible transportation that might be very early or very late. What's going to make the most sense? Some people have the problem where, for example, they can get dropped off at the place where the appointment is, but they have no way of getting inside the building and getting to the right office, right? Or they have a really hard time waiting for appointments, or they get so anxious about the appointment that it's like 2 or 3 days before the appointment, they can't sleep well, they can't, they're so nervous about it. So we need to think about ways to help make it easier for people, right, to see their doctors. Sometimes one thing we did learn during the pandemic is that some people sometimes do better with some appointments virtually and not just doing them in person, right? So like some things you really need to see your doctor face to face, but for some people, maybe some things could be done on video, like what we're doing now, or even over the phone. Another problem people have sometimes is, I don't know why this is, but sometimes we think if we're independent, we're supposed to be able to do everything by ourselves, but nobody does anything always by themselves, right? Like when I have a doctor's appointment that's hard and I'm worried about the information I'm going to be getting, I might bring someone with me, and I know that happens a lot for people of different kinds of disabilities where they might want to bring someone with them to help them understand information or to help speak about things that are hard to talk about or just to write things down. But sometimes in doctors' offices, they don't know how to be ready to have another person coming in. And they do one of two things. And you'll tell me if either of these happen to you. Sometimes they talk only to the patient, and the person who's coming to help feels like they're not like even allowed to be there. There's nowhere for them to sit. They're not allowed in the room. Or sometimes they only talk to the person who comes with the patient. And the person who's sitting there, who's the patient, is like, hello, what about me? So I think we need to figure out again, if you need help at your appointments, that's part of your team. So how do we all work together as one big team is really important.
You bring up a lot of really good points, and I'll touch a little bit on everything you just said right there. There's a new foot clinic that opened here in Ottawa, and my most recent appointment that dates a few weeks back was bright and early in the morning, so I had arranged buses. What happens though is my appointment was scheduled for 10 o'clock when the clinic opens, but as OC Transpo wants it here in Ottawa, I got at least half an hour, if not 40 minutes too early. So I was waiting outside. Luckily, I know how to dress myself to wait out in the cold. And when I shared what happened with um, with the foot clinic, the solution they said, well, from now on, we're gonna book you maybe for like early afternoon instead,
Right.
going forward.
Yeah.
Um, so at least that will avoid that scenario down the road. And you touched on another point as well. Several medical appointments can be certainly anxiety inducing for a lot of people. And so, for example, if I'm seeing my neurosurgeon, I don't have a family doctor, as several other people don't have a family doctor as well. But I have access to a neurosurgeon for my medical conditions. And so, if there's anything directly related with my medical conditions, I at least have access to my neurosurgeon. However, he's in a hospital setting, and don't ask me to navigate hospitals on
Yeah.
my own. It's nice to have, like, okay, MRI to the right, emergency to the left, so and so straight ahead. It's nice that my brain can't process that.
Yeah.
So I need to have a support person, or I need to have somebody with me, but I cannot express in words enough how it really drives me up the wall. It really drives me up the wall when somebody will start talking to the person next to me when I can clearly speak for myself.
Right.
We have the right to access and we have the right to healthcare. Talk to me directly, and if
Right.
something I don't understand, I'll go ask myself to who's ever at the appointment, can you explain this in easier language?
Yeah. Yeah. So ESA language is another thing, right? That we need to talk directly to people as best we can, but to think about the words that we use and how we explain things. And also we need help sometimes with wayfinding. It's not just about the appointment, it's the getting to the appointment. It's going to that space and knowing how you're going to get where you need to be and how you can help people to be less anxious. You asked about solutions, Melanie. One small solution, it's not everything, but I think you even mentioned it. When you spoke to the foot clinic office about what happened, they came up together with you for a plan of how to make it easier, which included only booking afternoon appointments, right? And they can record that in their book, right? So next time you call, they know only afternoon appointments for Melanie, right? Or Melanie needs help with wayfinding. So make sure there's a seat for somebody else to come to that appointment, but also make sure you're talking to Melanie, right? So sometimes we use tools. We have one tool called About My Health, and it's kind of all about you and your health. And we encourage people to use that and to make sure it's there, especially when you're seeing somebody for the very first time who doesn't know you, because it gives a lot of these tips, right? Like make sure there's space, make sure my appointment's at this time of day. These are things I like to talk about. These are things that make me anxious. And it's all right there in front of them to help make that appointment go better.
Well, yes, exactly. And as an advocate, this is something I say a lot. It's not a one size fits all for everybody.
Right.
And like we were just saying, because we talked a little bit about the pandemic, we all obviously know without any doubt about it that the pandemic changed a lot for people. And I mean a lot. In your work, what have you noticed that impacted athletes' health? Like, is there something in particular you noticed? And then I might share a few things that I've noticed being an athlete myself.
Right. Well, I'm really glad you're asking the question, Melanie, because I think some people, the pandemic was hard for so many of us in different ways. Some people don't like talking about it anymore, or they kind of think, well, that's in the past, right? No, mention the pandemic. But the truth is, it still kind of affects people, right? Like it was a big time in our lives. It changed things so much. And some people are still kind of distressed about it. So I think it's helpful for other people, including in healthcare, to understand that about people. Um, I think a lot of people felt isolated and lonely, scared, confused. Some people felt really bored because they didn't have anything to do. Some people liked the fact that things were a little bit quieter, and they could sort of gradually figure out what they wanted to do, and they built some of their own routines or activities. But it was definitely hard for a lot of people. And I think from the healthcare side, it was really tricky when a lot of healthcare was hard to get to, right? Because we do need our healthcare, and we need to not be afraid to ask for help in healthcare. And one thing I think happened with the pandemic is people, were thinking, well, my doctor wouldn't want to see me about that. They're too busy with other things. I just shouldn't bother, right? And actually, we should bother. Our health is important. So one thing we learned is that it's really important to encourage people to get back into the routine of seeing their doctor regularly. It's flu season right now. Like it's good to get vaccines. It's still good to get boosters around COVID. It's still good to get a vaccine for the flu. There's all kinds of things we can do to take care of ourselves and sort of deal with small problems before they become big problems.
I agree. I really agree. And I have to say that being an athlete myself, I have to give massive, like capital, bold, italic, massive, massive, massive kudos to Special Olympics for having online programs to keep
Yeah,
athletes like myself moving. I know
right.
not everybody has access to computer or internet or whatnot, but I was able to arrange our living room into a little dance party rooms because I know that all of my friends and fellow athletes just love, love, love to dance. We
The
love
dancing.
to dance.
Yeah.
So I would join virtual dances, and I also have to give another massive kudos to Special Olympics because in the earlier stages of the pandemic, um, I'll tell our listeners right now, I actually don't know how to cook. And so I have like little tools, like a little apple slicer, because I am extremely sorry, but my fingers are not going to go touch sharp knives. Thanks to the Special Olympics, I was also on a few cooking courses with them that I took from the safety of my own home. Special Olympics is a literal lifeline
Right.
for athletes like myself.
I hear you, Melanie. And I
You
think
know,
there's so many people who could sort of say the same thing, right, about their experience. One thing I just want to note from all of those things you said, they're all so important. But again, sometimes we think, well, there's no other way we can do things. Guess what? There's almost always another way, right? Like who would have thought of virtual dances or joining meetings in Maryland, right? I mean, sometimes we come up with things and we learn to use technology as an example, or we come up with a different way to get exercise than we would have thought before. And I think our health is like that because certain things go a certain way and then something happens. Well, we got to think of a new way to do it. And I think the only way we do that is we get creative, we work together, right? We understand the problem and we come up with a solution. And it sounds like that's really what Special Olympics was doing for you, I think, during the pandemic, which is great.
we often talk about physical health, but mental health is obviously just as important. Can you maybe tell us why it is important for athletes to check up with their doctors about their mental health? And what advice you might have for athletes to talk maybe more importantly about it? I know maybe not everybody can be comfortable.
Yeah, it's a great question. I mean, when I say it's important to check in with your doctor about your health, I'm talking about all parts of your health. So I sometimes say from your head to your toes, but also the things that go on inside our bodies and the things that go on inside our heads or our feelings, right? All those things are part of our health. So I work at CAMH. It's a mental health hospital in Toronto, and our slogan is mental health is health. So sometimes I think athletes think, well, who wants to hear about the fact that I'm really anxious or I'm really down, I don't want to do anything. Nobody wants to know that. Nobody cares. That's not a health problem. It is a health problem, right? Feeling really down or unhappy can make people very sick. And it's something that we can treat, just like we can treat problems with your heart. So we can get help for these things. So it's really important to let your doctors know about those things that are happening. If you're not sure how to talk to a doctor about it, to talk to a friend, to talk to someone in your family, someone you trust, who might have some good ideas to help you around how to deal with stuff that's happening with your mental health, because there's definitely things we can do to help people to feel better. And everybody has a right to feel better, right? So we want to make sure people are getting the help that they need.
For sure, for sure. And for myself here in Ottawa, if I ever need some help, I have some wonderful resources here. I'm lucky with the resources I have. I really, really am.
I was going to say a good thing that you just noted here, Melanie, is that you know where are the places you can go, who is there to help you, and not everybody knows those things. So again, I think that's something even at Special Olympics we can help make everyone on our team aware of. One number that's there for everybody when they're feeling very distressed and they need to talk to someone is 988. And when you start to tell them kind of what's going on, they're going to connect you maybe to a center that would be helpful to you. But you can text or you can call 988 anytime and they will listen to you. And we have some other resources too that are helpful around mental health and physical health that we can share so other athletes can look them up and families and learn about those things. So first step is having a conversation, right? Knowing maybe something is wrong. Even if you don't know if something is wrong for sure, you can still talk about it and find out if there's something you should be doing.
Definitely, for sure, for sure. I am obviously the type of person who loves to be organized. I have a bit of an unpredictable schedule, so I like to be organized and know what I'm doing. What are tools or resources that you might recommend for athletes, caregivers to use when preparing for health check-ins? And I just want to specify um, for athletes and or caregivers.
That's right. So it really depends on everyone's situation's different in terms of who's going to do that preparing and whether it's something you're going to do together with somebody else or you're going to do it all on your own. Or maybe in some situations it's hard for you to deal with and you just want someone who knows you really well to help deal with that piece, right? So one tool I really like, we were talking about before, the health check-in, just sort of outlines different topic areas that might be good to check in about. So talking about things like using technology, or do I have enough money to do the things that I need to do every day, or transportation, or my relationships with other people. right? Or my mental health, or how I'm feeling with my physical health, and kind of just circling or picking the topics that are most important for today. There's another tool that we have called Today's Healthcare Visit. And it really just looks at, I'm going to the doctor because of these things that I want to talk about. So the little tick boxes that you say which things you want to talk about, which problems you're having, right? And so you come with that information so the doctor can see that information. And then they do something and they give information back to you, right? Like, here's what we talked about today. Here's the plan, right? So again, talking about how we can all be on the same team. I think some of these tools that communicate what we want people to know about our health, and then the health people can tell us back what they think we should do. Because sometimes when you walk out of an appointment, you're like, I don't know, what did we just talk about? I don't remember anymore. Right? So having it written down for other people to see also is a really good way to make that communication work better.
I think there's a slogan or something that says nothing nothing about us, nothing without
Without
us
us.
about us, or nothing.
Yeah, you got it. Nothing about us without us, right? And it says you got to include us or include
Yes.
you, right? That, like, if it's about your healthcare, you got to be included in that process. And again, I just say we're all on the same team. Let's work together like a team, just like we do in sport, right? Think of healthcare as sport.
Well, I really want to take the time to say thank you so much, Yona, for sharing your thoughts with us today. Thank you very, very much. Remember, regular health check-ins are a big, huge part of staying healthy.
Thanks, Melanie. Thanks for having me. It's great to be on the show.
Okay, then, so we are back talking about the importance of regular health checkups for Special Olympics athletes. And now we are joined by Dr. Ullanda Niel, who is a family doctor, to give us her insight. I now turn things over to you, Dr. Niel, to introduce yourself and maybe give us a bit of an icebreaker to tell us a little bit more about yourself.
Hi, my name's Ullanda Niel. I'm a family doctor. I work in Toronto, and I love to bake. So it's almost birthday season in my household, so I bake a lot of birthday cakes.
I'm kind of glad to see that a doctor likes baking, because I'll make an admission right up front. Yes, I'm an athlete. I do admit I'm an athlete, but I also admit at the same time I'm a big, humongous sweet tooth. I love desserts a lot.
Me too, Melanie. That's true.
So then, to get started officially, can you please explain why routine health visits are particularly important, and what families should do if they don't have access to a family doctor?
Well, I think health check-ins are extremely important. They're important because it helps you get a good relationship with a doctor so that the clinic knows you and you know how the clinic works and feel comfortable to share more at other visits. But also, it helps you find out new things about your health that you might not have noticed. So a lot of times we go to the doctor when we have a cold or something is hurting, but we might not remember to go to the doctor to check on things like, do we need new glasses? Should we be checking in to go see the dentist soon? How's my blood pressure? There's so many important things that need to be checked on a regular basis, and sometimes we just don't remember. So these regular annual, maybe like once a year kind of visits are really important. Now, what can you do if you don't have a family doctor? That is such a common problem right now. And I hope that it's something that we're working towards solving, especially for people who have intellectual disability, right? Because if you are looking all the time for a family doctor, it's hard to get that relationship that you need. And it sets you back in your healthcare journey, right? sometimes you could try going to a walk-in clinic regularly so that maybe you see the same person more often. But I just don't think that's the perfect place to do something like that. And I would say continue to look for a family doctor. Some people, what they do, they will ask a family doctor that sees a family member. Maybe they'll be willing to kind of squeeze you in along with as a patient too. Also looking for new practices and looking for types of clinics where they work in teams is really helpful. So like at my clinic, we're really lucky. We have social workers and nurses, we have foot care, and we all work together. And so that type of clinic is really helpful because sometimes they have more time and more people that can help you.
Speaking for myself and my situation, I'm very lucky that while I don't have a family doctor myself, I at least have access to my neurosurgeon. So if I have anything directly related to my medical conditions, I can at least go see him directly, which is a blessing because I know not everybody has that. And
Some
I know
people are
with
really left hanging, like they have not sure where to go.
what are some common challenges people face when it comes to health checkups and how can we overcome them? And before I get you to answer that, I'm going to have one word. Like, I'm just going to say one word and I'll elaborate after you've answered. Transportation.
Oh, yes. Transportation is one of the big ones. So it is not always easy to get into the doctor's office. And sometimes that means that you need to get someone to take you. You might need to be arranging Wheel-Trans or your equivalent kind of transportation, and you have to book in advance. It can be very stressful. So I'm mindful of that. And as a family doctor, sometimes I think about that when I'm planning what kind of visit I'm going to book. So if I need to see the person in the clinic in person, I'll do that. Or if it's something that we could do by video or on the phone, sometimes I do that too, if transportation is a big issue. But accessibility is the real thing. So being able to make your clinic accessible for the patient is a big deal. Sometimes people have other disabilities that are invisible, like an intellectual disability, but we still have to find ways to make the clinic visit accessible for your patient who has an intellectual disability. And so that might mean preparing for the visit so that the patient can write down a little bit before they get there so that they can have their thoughts organized, and writing stuff down to give to the patient at the end of the visit so that they can review it later, and using plain language. So instead of fancy doctor talk through the whole visit, taking a minute to speak like a human it can be helpful. Also, sometimes I use pictures, or like today someone asked a question, so I went on the internet and I found a picture of what just Googled a picture and then showed what I was talking about. Another thing that sometimes clinics say, you need to go by yourself into the visit. And if you want to go by yourself, of course, it's your privacy. But if you prefer to have someone who can support you, who might help you to remember or might explain something that you forgot to explain, then they should be allowed to come with you.
I agree with a lot of what you said, Dr. Niel. I really agree with a lot of what you said, and some of what you were just explaining is very relevant to situations that I have faced about accessibility. Yes, there are big terms that are very difficult and very complex to understand. So having things in accessible language is more than important for people with intellectual and developmental disabilities. And towards the end, you mentioned having a support person there if it's needed. Sometimes what I notice and see is, yes, people might need a support person to accompany them during so-and-so appointment, but sometimes, often, people addressing the support worker and not the patient directly.
Mm-hmm.
That, as an advocate, is something I find quite bothersome, if not disturbing. If patients are not verbal or non-verbal, there's other ways to communicate, and I wish healthcare professionals out there would take the time to address the patient and or person directly in easily explained language or simplified language.
I agree with you. And you know what? It's just tempting. Sometimes you think, oh, I will get the quick answer by talking to the support person. But you know, sometimes you don't always get the right answer either. It's actually good to talk to the person who it's their body and they're trying to explain something to you about. And also, if you're going to be asking someone to go through different tests, do all sorts of things, I think you should talk to them, right? So
Agreed. Yes,
right?
definitely. Yes.
Forgot to mention one thing. Remember, I was saying that you could prepare for the visit? There is
Yes.
a nice form that's available with, it's on the Developmental Disabilities Primary Care Program, so DDPCP website. So if you Google DDPCP, you'll find it. And it's called Today's Healthcare Visit. And it has a little bit of an outline of what you might want to do before you go to the doctor's office so that you can bring it with you. So you could use that form, or you can use your own way of writing down something about your health so that you're ready when you go to the doctor's office.
Thank you for that great information. I'm sure it's going to be beneficial to a lot of people with intellectual and developmental disabilities out there. Thank you for that, Dr. Niel. So then, how important is it for family doctors to address mental health during checkups, and what can caregivers and even coaches do to help support mental health?
Mental health is part of your overall health, and your physical health is not good if your mental health isn't good either, right? A lot of people have times when they struggle with their mood. Maybe they feel sad. Maybe they don't have good sleep. Maybe they're not eating well. And these things are all tied together with your overall health. So you must ask the question to see how people are doing with their mental health. And we also have to think about the people that surround them. So like if you live with your family, is your family okay? Is everybody feeling well, both physically and mentally? Because that affects everyone, right? You're all interconnected.
For sure. Those are really great tips. Thank you for sharing that. What tools or resources would you recommend for athletes and their support network to use when preparing for any or all upcoming health check-ins? What's out there for us, Dr. Niel?
So I really like the form from DDPCP that my healthcare visit, I think it's today's healthcare visit. And then there's another form called About My Health, where you can write all about your overall health, and you can keep that with you so you can go to any doctor's office. It doesn't have to be just for your health check. On the Nuts and Bolts website, you can Google that. They have some little checklists that might be helpful. Like if you have someone who helps you or who works with you that might want to help you fill out checklists for things like if you're having tummy trouble, or you can keep track of your bowel movements, or something that can help you if you're having trouble with your periods to keep track of your periods, or something that can keep track of your pain if you're complaining of pain. So those type of things, so that when you get to the doctor's office, you have really detailed story about what's happening. Because sometimes, I don't know, this happens to me when I go to the doctor. I can't remember all of a sudden anything. So I'll say, doctor will say, when did your pain start? And I think, oh, I don't know. And how often is it? Is it every day? I don't know. But if you have these things checked out already, then you can show them.
For sure. And I hear you on the memory, because the conditions I myself am born with affect my memory. So I am not always able to remember everything either. So, as we continue on, in what ways do you make your workspace accessible for individuals with IDD?
We try to think about people who are uncomfortable in the waiting room, because some people, due to sensory issues or different things, don't feel comfortable to sit there for very long. So we think about like what time would the appointment be. Some people do better in the morning or in the afternoon. Some people really have trouble waiting, and I'm always late. So it's better if they have the first appointment of the day or the first appointment after lunch. Sometimes we will say you can wait outside or in the car, and then we'll come get you right when the appointment's about to start. So even before the appointment starts, we're thinking about ways to make it easier. Once you come inside the clinic room, I try to have enough space for the whole team. So we're lucky we have one room that's just like a normal clinic room where I'm in right now. But if someone comes with lots of people who are supporting them, then I have a bigger room. So then we can have everybody in the room together. And it's got a little casual spot with a couch. So someone can go and sit there and feel a little more relaxed if they're a little bit nervous about being at a doctor's office. During my visits, I always make sure that I talk to my patient directly. And then, if they don't have like a ready way of communicating, like perhaps they're nonverbal but do not have like a iPad or anything to communicate with, then I might also say now I will speak to, and I'll reference other people in the room to get some more information. But I always are mindful that my patient is there, and I engage with them and do physical exam and everything, so that they know that the appointment is for them, and that I can understand how they're feeling when they're there. I also, at the end of the visit, like I said, I like to send a summary. So I always write a letter to my patient that says everything that's in the today's visit form that I was talking about earlier. And I try to include resources that are helpful, like things with pictures or links to some videos or other documents that can make it easier. So when people are leaving my office, I'm thinking about what their needs might be for accessibility in other places. Like if they're going for blood work, maybe I can give something that explains what's going to happen when you go for blood work. Saying going for an x-ray, I can give you a video shows you what an x-ray is and how does it feel when you get an x-ray, so that you're ready for your next appointment.
I really appreciate you bringing that up, Dr. Niel, because with all the medical conditions I have myself, I know what it is to be prepared for upcoming medical appointments, but you're bringing something up as to how anxiety-inducing things can be. Speaking for myself, I don't do needles very well, so I'll need to have like somebody count like 1, 2, 3 or 3, 2, 1. Or I'll have like maybe my mom come in and hold my hand. Really, really scary. And I really applaud the fact that you were talking about bigger spaces where you can accommodate like couches or something like that. For myself, I need to know what's going on. And I like if doctors like yourself are able to explain step by step what's going on, let me tell you right now that you don't have any idea as to how that can really help alleviate pressures. Like if I'm told what's happening and how it's going, regardless if it's for needles or for dentists, those are the two biggest things that really, really scare me, needles and dentists.
But you know what you said, that reminds me, it's like a good thought, is that people have already some tools in their toolbox for when they feel nervous. And so you even know, okay, I need to make sure someone's here to hold my hand. I know, you know, the things that help you feel calm. And so it's good to ask too. Like we, as doctors, we don't know everything about what works well for you. So we could always ask you, or you can tell us the things that help. Like some people say, oh, I'm very good if I listen to some music. Other people are very different, and they say, actually, I need to see what you're doing. So I would like to look at what you're doing. So you never know. It depends on the person.
So as we wrap up then, I would love to hear your advice to our listeners. What is one piece of advice that you would give to athletes or family members to help support the health of the fellow athletes or of fellow athletes?
That's easy. I think you should go get a health check at least once a year, hopefully, to go to your regular family doctor or nurse practitioner, get your body checked from head to toe, check on your mental health, make sure that you're connected for eye care, dental care, and that all of your medications are properly monitored. I think it's so important, and I'm so happy that we had a chance to talk about it today. Also, I think you're athletes, so I know you're active, and that makes me feel very happy. And I also want everyone to be mindful about healthy eating and taking care of their sleep, because these are all things that help with your overall health.
Thank you so much, Dr. Niel, for sharing your valuable insights today. I know you're a busy person, and I really do admire the time that you've taken today. So thank you so very, very much. We certainly have learned a lot about how family doctors play a great role, but I think more importantly said, an integral role in supporting athletes' health. So thank you so much, Dr. Niel, for being so supportive. Thank you for taking the time today. Greatly appreciated.
Thank you so much, Melanie. It is my privilege to speak with you.
I am excited to have Heidi Mallett, Monique Shah, and June Shah with us. So let's start with some quick intros and possibly an icebreaker. Please introduce yourself and tell us what your favorite sport to watch is. Let's go with Monique and June first.
Okay, Monique, go ahead.
Okay.
Introduce yourself.
My name is Monique Shah.
Mm-hmm.
What sports I watch?
Mm-hmm.
I watch basketball and Raptors.
That's your favorite.
That's my favorite.
Okay. Oh, my name is June Shah, Monique's mom. And this is a hard one because there's several sports I love to watch. I'm a sport fanatic. Put it that way. I love, and I'm into the winter sports quite a bit. Ice dancing, skating, yeah. And my next one would have to be track and field.
Heidi?
Thank you, Melanie. The sports I like to watch is mostly hockey in the winter months. I do watch other ones, but I really enjoy watching hockey.
I must say, I too am a big, giant hockey fan. I really enjoy Montreal, so nice to share something in common with you, Heidi. So, to continue, we have heard that regular health check-ins are super important, especially for athletes with intellectual and or developmental disabilities. Heidi, could you please share why you think regular checkups with your doctor or any healthcare professionals are so important for athletes with IDD?
I think regular checkups are important because not only for people with intellectual disabilities, it also helps them to maintain their health as long as possible. Give you an example. Twice a year, I have to go get my eyes checked because I have glaucoma. So that's important. And when you go to your doctor regularly to get your blood work done, those things are important because you want to stay ahead so that you will remain active as long as possible, and also to make sure that everything is working in good condition as much as possible. Because sometimes it could be just a matter of changing medication, or you may need some treatments in other ways. Thank you.
Yes, I can relate with you on the glaucoma. That's something I have myself, so I can easily relate. And for you, Monique, why is it important for you when you think about being prepared for doctor's appointments or any medical appointment for that matter? What helps you get prepared ahead?
You write your questions.
I write my questions, and then I get
To ask your doctor.
and ask my doctor what's wrong with me and stuff, and I get checkup every day.
Good for you. I really applaud you on doing that. I know for athletes, sometimes it's really anxiety inducing going to medical appointments. I know everybody goes through different situations, and uh, it's different for everybody. But one thing I think we can all agree on is that medical appointments are never an easy feat or never an easy thing to go through. And for you, June, how do you remind and support athletes in keeping up with their health checkups? What role might you play in their overall health?
Okay, so as Monique mentioned before we go to doctor's medical checkup to have a medical checkup, we always have to have a little sit down and a little chat. And because Monique has, like you mentioned earlier, anxiety, and which affects her expression. So we have to have her in a calm environment to, so she can explain to the or express to the best of her ability what is really bothering her. Sometimes it does not always come out in words, but I can tell from body language. Yeah, which is why we really, really like her doctor, because she understands this part of Monique. Communication is really, really a big key. And we're at the point now where I do not have to go into the room with Monique when she's talking with the doctor, because her doctor is so awesome. She understands Monique's baseline. She understands how to communicate and how to get certain information out of her. So I would prep Monique by writing the questions down for myself to remind me, because I forget too. And then on the way in the car, we will keep rehearsing. Okay, Monique, you will talk to Dr. Orderly about this. You will talk to her about that. Don't be shy. Be open. You can talk to her about anything. If you don't understand, just point to your body where you're feeling whatever. So this is how I prepare Monique, even myself. Yeah, because as adults, we're getting to this stage where, we don't remember everything. So writing down things are very, very important.
I can certainly relate with you on the anxiety department, because some of the conditions I have myself, I can be prone to anxiety very easily, very quickly. So I appreciate what you're going through, but I find it wonderful that Monique doesn't need to go in the doctor's office um, with support. Monique, you should be proud of yourself for going like by yourself. That's wonderful. My family on my end have always encouraged independence. So hats off to you, Monique, for that. That is a huge undertaking and a huge step. And for both you, Monique and Heidi, have either of you felt nervous about medical appointments? Maybe you even practice what you would say ahead of time?
No, I'm not nervous.
Yes, I think for me, I get a little nervous just because when I go to meet the first healthcare provider or doctor for the first time, because you don't know what that environment is like, or if they use words that are not familiar to me or to the individual, that can be challenging. So usually what I do for the first visit, like for an example, a few years ago, I had to go to a new eye doctor. So because I didn't know what he was like and the environment, and I knew he was going to ask me a lot of questions. So I brought my mom with me to help me answer some of those questions, because basically the questions they're going to ask you is from the younger years, how I was diagnosed and how things came about and all that kind of thing. So as time got on, after maybe this first visit or second visit, I don't need her to come in with me unless there's something he needs to talk to her about. But he'll make sure that I'm there, because that way it's good for both of us, and it also puts me in a comfortable environment so that I'm aware of who this person is or who his staff are. And then also to make sure that if there's something I don't understand, is don't be afraid to ask. Can you please put it in a language or plain language so that I can understand why you're the information that you're providing to me? Or say, I don't understand that question, but can you please put it in a language so that I can understand it and be able to learn from it?
Sorry to jump in here, Melanie, but totally understand where Heidi's coming from. Monique is fortunate to have had the same doctor for a number of years. We came to Toronto in 2003. And so I guess this is why she's saying she's not nervous. But yes, in the beginning, it was the same. Just as Heidi, I will go into the room with her, like anything else you athletes are faced with for the first time. You have this nervousness, yeah. But after a while, then you become comfortable with the same person. Monique is very sometimes she gets very talkative, and she's very easy to talk about. It's very easy for her to talk about herself. Asking questions is another issue, but to get her to just tell me about yourself, Monique, the doctor knows her very well, and how to prompt her and how to get certain answers out of her. This is what I was saying. It is important for the doctor to understand her patient.
What would both or even all of you like to say to any and all other athletes who might feel nervous about going to the doctor, or if they don't have doctors, to any health professionals?
Okay, Monique, you want
Okay, that's a good question. When you tell all the athletes, Special Olympics, when they go to the doctor, or you can get your parents to go with you, or you can do it by yourself.
Yes. So the one way of not being afraid is to have your parent going with you, or a support person.
Or a support person to go with you in the room.
Yeah.
I'm going to add to that because I totally agree. I think it's for an athlete and for all of us that are able to do it that way, I think it's important that you do have a support person or parent or a caregiver, because that will help you feel more uncomfortable in the environment setting that you're going into. Just because, like I said earlier, the challenges of understanding information could be a little bit challenging at times, or they may make you feel overwhelming, especially the first appointment, because they have to ask you a lot of medical questions that you may not have the answers to. And that's why it's important to write this information down or to prepare your answers with a family member or a support person, whoever's taking you, beforehand, so that you're ready to give those answers when they ask you those questions. Thank you.
Yeah, I agree, because I know a lot of times when you're at the doctor's, they'll use big, long, lengthy words that are next, if not near to impossible to understand. Speaking for myself, I have something called my chart where I can go see stuff for myself, but there's a lot of words in there that I often don't understand a word as to what it means. Well, I think we're getting close to wrapping up here. So I would love to hear, what is one piece of advice you would give to athletes, coaches, family caregivers to help support their health or the health of a fellow athlete? Because we all know each other in the Special Olympics, obviously.
One of the things as a caregiver I find, and as a woman and as a patient, I find very, very, very important is that your doctor or the healthcare person, whoever you're going to, it is very, very important for them to understand your baseline. Sometimes a lot of these athletes, they get misdiagnosed. They're prescribed wrong medication. Um, you know, what works for one does not work for the other. Yeah. So it's important. And because there's not so much, let's say, research or heavy research that has been done on female, which affects all of us, not just athletes, but all of us, you know, female health, reproduction, a lot of tests have been done mostly on men, right? So women suffer quite a bit. Yeah. And it is very, very important that your doctor, again, I reiterate, knows you and understand your body. Sometimes you go in there, you don't have to say anything to her. She just looks at you, or he looks at you, and he understands and he knows exactly what is happening. Monique herself has been involved. Monique and I actually have been involved in 2 car accidents. Yeah, we're rear-ended in the back, and you know, that took quite a toll on us. Really changed Monique's mood, how she communicate with people, you know, and this and that. And her doctor knew exactly what to do. Sometimes as a caregiver, we get emotional. Words fail us. Yeah. My doctor knows how to calm me down first so that Monique will be calm. Yeah. So, you know, it's, again, as much as going to the doctor is important, the doctor needs to understand you so that you could be treated correctly. Yeah. Okay.
I like to add to that, only to say that I think healthy screening programs, when we have them at our Special Olympics events, are very helpful for the athletes. Just because then they have the freedom to feel comfortable to ask questions or to get tested for their eyes or ears or their feet, we'll just use that as an example, or the strong mind section, or fitness, and or just as simple as getting a blood pressure checked. And you know, sometimes those are concerns, and for people, and then they say, okay, we will send you further to see an actual doctor if that's needed at that time. And those things are important because those healthy screenings, if we didn't have those resources, the athletes probably wouldn't be going to the doctor as much, or, you know, finding out what's really going on with them. And sometimes people are being left too late to be diagnosed with certain things too late. They're on too much medication, so they're not properly being diagnosed. And maybe if healthy screening can properly diagnose people, maybe not totally, but at least pave the way to say, you know, you need to get further testing, or you need to actually go to see your doctor about these kind of things. For an example, back a few years ago, I went to health screening. We did a bone density test. It was recommended that I go there. So I followed up with a bone density test. Of course, mine was good. And then at that same time, my mother was able to go for hers as well. So it was an open door of opportunity for that, because otherwise that probably wouldn't have never happened. So we hear stories of similar stories like that, and I think that's why it's important to go to healthy screening if you don't get all your proper checkings every so often. And those things will help you along the way, because some people are at a higher risk than others, especially if they're not as active. Thank you.
And one thing I might even add to what was just being said, it's a chance for athletes like us and for everyone to do some advocating, because sometimes disabilities are not always easy to see. If somebody has Down syndrome, you'll see it.
Absolutely. Yeah.
If somebody's in a wheelchair, you'll
Yeah.
see it.
Absolutely.
Or if somebody is blind or visually impaired, you'll see it. However, what happens if it affects the brain? Like, we can't always see that. So
Yes.
the more the doctor gets to know the
No.
patient, the
Yeah.
more advocacy. And I think that's a wonderful thing. So I think we did pretty good for our first podcast. And I want to take the time to say thank you so much to our guests for sharing your valuable insights today. I know we all have busy schedules, but thank you very much. Thank you very, very much. This Special Olympics edition of the podcast has been made possible through support from Special Olympics Canada and the Azrieli Adult Neurodevelopmental Centre at the Centre for Addiction and Mental Health in Toronto, Canada.